Good morning. If I could ask the doorkeepers to close the doors. Good morning. If I could ask everyone to come on in, and let's get started. Chairman Harmon, you ready?
Yes. Thank you, Mr. Chairman, members of the committee. Good morning. I appreciate all of you getting here so early. I know it's a busy and hectic time, this time of the session, so we want to try to be brief. My intentions are today to give a summary of where we are, give you plenty of time for questions, and then tomorrow do a more thorough item-by-item coverage of this on the floor, unless you object to that. If I try to do that today, I think we will eat up all of our time, and you won't have time for questions. This will, as you can tell, this will take some explaining to do. So if you will bear with me, and if it's okay with the committee, I will cover what we have, where we are right now, and try to open this up for questions after that. First thing, I want to cover a few things about where we are. As all of you know, you've all been working on this document for 2.5 months now, almost. House Bill 119. The totals for this in state funds are $18.6 billion. You'll see that on the front of your document. By comparison to 990, which was last year's fiscal year 2009 budget, which had $21.2 billion in state funds. So we're $2.6 billion less in state funds, or 12.3% down. But that does not take into takes into account one-time monies that we were able to pull in. So if you go back and look at just the portion of 119 that comes from just tax collections, our revenue sources. So if you take out lottery, if you take out tobacco, if you take out our RSR reserves and other one-time reserves, we are down $3.1 billion, or 15.5%. I say all that just to make it ultimately clear. We've had to cut. And when you go through this document, you will see that. There have been a lot of agencies that have been cut. There have been a lot of agencies that have been cut harder than others, but we've had to prioritize. We talk about, the buzzwords about right-sizing and opportunities in this difficult times. Well, it means you have to cut. And so we've done that. So when you see cuts, it's not because it's a program we didn't like, it's because it's the position that we're in. We were fortunate that we were able to recognize some federal stimulus money. There's $1.4 billion of federal stimulus money in this package. None of those $1.4 billion obligate us to a program in the future. It is being utilized in programs that we do existing in education, in Department of Community Health, in Department of Human Resources, in Department of Corrections, and in public safety programs. We've utilized it where we thought it was best to soften those cuts. So with that $2.6 billion hole we had, $1.4 billion helped us to significantly soften cuts in some areas, and you will see that here. But due to the magnitude of the downturn in revenues, education had to be included. And there's going to be questions about the education cuts, but I want to make it very clear that as a percentage of this budget, we fund education more than it's ever been funded, K-12. 46.17% of this budget is dedicated to education. So we're still trying to meet that obligation that all of us have of keeping education as our priority. But there were cuts. And hopefully as we move through this process in the Senate, working with the Senate and with the conference committee, we will continue to utilize those funds and hopefully have it in the areas that you will understand are most important throughout the education department. The House Appropriations Subcommittees, and I want to thank all of you. The subcommittees have worked tirelessly over the past few weeks. You've made a lot of terrific recommendations. You've all been involved, or most of you have, and I appreciate those of you who've taken the time to show up for meetings, ask questions, and try to do this job, this difficult task that lies before us. But in this budget, you'll see a restoration. The governor recommended that we cut hospitals 10% and providers 6%. Now, these folks have not had a rate increase in 7 years, so to take that type of cut would have resulted in hospitals closing, providers giving up their Medicaid practice. And folks, in this time, in this environment that we find ourselves, that is the wrong approach to health care. So the DCH subcommittee restored those cuts. So we brought the hospitals and the providers back to level. They still haven't had a rate increase in 7 years, but I don't think you'll hear them complaining, considering the predicament they would have found themselves in had we gone with the governor's recommendations. And I applaud the DCH subcommittee for that. The governor also recommended that we change our state health benefit ratio. Today, we currently pay 75% as an employer. The employee pays 25%. The governor recommended we change that from a 70% to a 30% ratio by employees, which would have resulted in many cases to a $600 to $800 a year increase in health insurance premiums for our state employees, which includes teachers. DCH subcommittee, along with all of the subcommittees, worked together to find money to remove that and keep that at a 75-25% ratio. This is, again, in this time, state employees aren't getting pay raises. And the last thing we need to do is go out and take more money out of their pockets for health insurance when we can find those available funds, and make that a priority to keep our state employees who are struggling with furloughs, in many cases layoffs. But those who are still with us, I think it would have been devastating to morale for us to hit them with an $800 increase annually for health insurance. So I applaud your work there as well. We've restored the Mercer and Morehouse School of Medicine along with residency training, because as we've talked about, we're 37th to 40th in the country, depending on what poll you look at, in physician per capita ratio. That has got to be addressed. That is not a problem that will go away if we don't address it. It takes money. So we've restored the monies to those programs to make sure that places like MCG and Emory and Morehouse and Mercer and a lot of those residents who practice at Grady can continue to practice and become physicians, because we know that through residency programs, where they do their residency is where they're more likely to practice. So if we can encourage those residency programs and keep them practicing in Georgia, it will help us to meet those needs that we will have. That's not something we might have. That is a need we will have in the future as our population ages and Georgia continues to grow. And as we come out of this tough time, we will grow again as long as we handle these downturns properly. And I think this is a right move to make sure that our residency programs are properly funded so that in the future we will have the physicians to meet the demands of a growing population. Restoration of school nurses. This is something we've all gotten an email or two about, I'm sure. You know, it's kind of like so many things that we take for granted until somebody tries to take it away. And what we learned is that, especially in this tough time when people are, in some cases, losing jobs or maybe having to give up their health insurance, that sometimes that child, their first line of medical care may be that school nurse. And that is a position that we felt very strongly about. The Education Subcommittee did a great job of funding that school nurse program. Now, that's $30 million that we will put back in. I want to make a point and make it clear that, you know, we were taking away our $30 million. The counties, the local governments, local boards of education commit $25 million to this. This is a $55 million program. But that $30 million would have devastated it. They would not have been able to pick up the slack in some cases. Your wealthier counties would have. But those counties that probably most need that school nurse in that building would not have been able to pick up the slack, and we would have lost those school nurses. So I applaud the Education Subcommittee in restoring that $30 million for school nurses. The National Board Certified Teacher, the salary supplement. There's a lot of debate and discussion about whether it's the right thing to do or the wrong thing to do, whether we spend too much. There are about 2,500 teachers that benefit from this. Just very similar to HTRG when we made that commitment last year, and we filled that commitment in the 2009 budget so there would not be a whopping tax increase on our citizens. We made a commitment to these teachers as well. And we felt that that discussion may be had over time, and we'll talk about it, whether there is a better way to fund those so that we do see results of that teacher program. But in this budget, you'll see we've restored the National Board Certified Teacher Program right now because we have made a commitment. Those teachers went through the process that we asked them to go through, and if they did, we said we would do this, and we're still going to do this. Now, this discussion will go on in the future about is there a better way to have a better teacher so that they can do a better job, especially in those difficult areas around the state where we're having trouble and struggling with education numbers. But right now, this is a commitment we've made, and I'll ask you please to support the House position, and I applaud Chairman Lindsay for doing that and putting that back in. There's additional funding for QBE. The QBE formula that the governor offered was a significant cut. We've reduced it slightly, using some of the federal stimulus money to try to make sure that money, which most directly gets into the classroom. So we've reduced the austerity cuts in QBE formula. We have full funding for K-12 enrollment growth in the university system and the technical colleges. So we're meeting the needs based on the growth of our population. We have 515 slots to unlock the waiting list included in this budget. Crime labs are back in this budget. Not only are the crime labs back in this budget, now we're still working with a process there. Part of what you do in these tough times, you try to find ways to meet the needs you had, but maybe work with a partnership with others. And we're asking those counties, we're working with ACCG, Chairman Martin has met with ACCG and GMA to try to come up with a way to partner with those counties that participate more heavily in those crime labs where they're located and possibly soften it so we don't have to have the full load. And so we can ensure that with everyone working together, we'll keep those crime labs open in the future. We're also including some equipment money in the bond package of $1 million to help them meet the needs of the equipment that they so desperately need, especially in those high-volume crime labs. So we are doing our part. You will see, I'm going to cover a few other items in a few significant areas, and if you have questions after that, I will try to answer them. I'm going to go through some of this, but I don't want to, as I said, bog us down because this will probably take me a few hours just to present tomorrow in a line-by-line basis, but I will do that. But I ask for your indulgence today as we try to just summarize, because so many of you have worked on this now for 2 months, as I've said, and you probably tired of hearing it. But I appreciate your work. As I pointed out in education, we're at 46.6% of the budget, or 46.17% of the budget. I want you to remember that. That's a key figure, because we are still holding that commitment to education. It is a larger percentage than we have had in the past 5 years in our funding to education as a budget in K-12. Under the stimulus package, the governor's revised estimate was a $450 million, as I pointed out, to cut hospitals and providers. We've restored that. The Health Subcommittee reinstated those provider cuts, pulling down a larger draw from the stimulus package, which allowed us to do some other things as well throughout that DCH budget, which included those federally qualified health centers that we try to do every year. There are 4 of those in here meeting the priority list. It also allowed us to meet some of the needs, as I said earlier, with our health insurance premiums. We funded the nursing home fair value rental quality incentive program. This is it was a slight increase for us, but it just put them on a fairer basis so that they could draw down the federal funds that they needed to draw down because we did not have that program in place, and I applaud the subcommittee for doing that. There is they provide family planning services in Medicaid, $225 million in total funds. As I pointed out earlier with Mercer and Morehouse operating grants, they have been restored back to their levels of last year because those grants operate. They do a great job of making sure that physicians stay in our rural parts of the state especially, so I applaud them for that. We fully funded our graduate and undergraduate medical education, Southeastern Firefighters Burn Foundation, and trauma funding, which is a big item. The governor included $23 million of trauma funding in his budget. We added $10 million, so there's now a total of $33 million in trauma funding in this budget document you have before you. We understand the need. That is a statewide need and something that we have to at some point settle on a funding source for a trauma system in this state because we are way behind. In DHR, we recognize $45 million in stimulus money in DHR. This allowed for child care for low-income families, child support relief efforts, foster care. Meals on Wheels is included with $1 million in this budget, which was not in the governor's. The food bank funding at $1.1 million is in this document. Grant and aid restoration of over $2 million, so that meets every county in our state. And then mental health and addictive disease. Mental health, disabilities, and addictive disease, we have $5 million in federal funds have been restored. So you can see there's a lot of good things that I've covered here, the highlights. Yes, there are some difficult choices that were made, cuts that were made. But overall, this document, I believe, and I think all of you would agree, is much better than the document we were presented just a couple of months ago because of your hard work and your efforts to ensure that we do meet our priorities. We met our priorities by still cutting, as I said, there's over $3.1 billion in cuts to state collections, $2.6 billion lower than last year, but using the $1.4 from federal money to help us soften those cuts. Mr. Chairman, if there are specific questions to issues, I would like to answer those.
Do I have any questions? Who was 61? Representative Hanna.
Mr. Chairman.
Yes, sir.
Under natural resources,
What page?
Page 66, 32.7.1. It has reduced the funds for George T. Bagley State Park and Little Oak Muggy. In essence, that's actually closing those parks. Are they talking about privatizing or?
Yeah, well, what they're doing, and I'm glad you brought that up, Mr. Hanner. I did not have that in my notes to cover, but with our state parks, our golf courses across the state, we are looking to privatize those golf courses. That will save the state about $2 million. They're wanting to work with the local communities first to give them the option to help do that, and so we will. That is what will happen. The result will be, I believe, a better run golf course, because I don't think we'll actually close them. I think when we move them to privatization, you'll have companies that or communities that understand the needs and will actually do a better job of operating them. We'll still partner with them, but I think that first step, we have to go ahead and try to privatize those, because as you've seen in this document, we've had to make so many tough choices between education and health care, and if we can find ways to lessen that burden in other areas, then we ought to take advantage of those, and that's what we're trying to do here.
But you're talking about lodges and golf courses.
I think it's lodges and golf courses. Is that correct?
Lodges.
You want to answer that one?
The department is looking at the golf courses first. That's their first thing they're going to do on an RFP or request for qualification. Then the lodges, June and July is when they'll look at the lodges. So they're looking at that. That's correct.
Because we lose money on those golf courses, Mr. Hanner, as you well know, and we think through privatization will actually save us some money, and hopefully the result will be a much better run golf course.
Any other questions? Who is 35? Representative Hughley.
Thank you, Mr. Chairman. I'd like to thank everybody for their work on the budget. There were some concerns from seniors, and I haven't had a chance to see if all those have been addressed, particularly as it relates to transportation and the meals at the senior centers and Alzheimer's, respite services, and all that. Can you speak to those issues?
I'm sorry. It's all been restored except for the transportation. There were some senior centers that were actually being zeroed out, and there were specific areas, and we've actually restored those as well too, except for transportation, which is, as you know, a difficult one we've dealt with for years. We're still working on it, and hopefully in better times we'll be able to put more money into that, but we have restored the Alzheimer's and those senior centers.
Do I have any other questions? I have a motion to approve and a second. Any discussion? Hearing none. All those in favor signify by saying aye. Aye. Any no? Ayes have it. We have due pass of HB 119.